Good evening, everyone. I hope you're all very well. Firstly, a big thanks to all of the people who watched and then sent me messages on my last chemo and ringing the bell. It's very much appreciated. But you will remember, for those of you that watched my Friday vlog, that I hinted that I was going to put another 2 vlogs out fairly shortly. So this is the first one. And guys and gals, we're going big because this is a radio show. Not done that before, but that's what this is about. So how did it happen? Well, I have a friend called Dave Young, and here he is with his lovely wife, Naomi. And unfortunately, Dave was diagnosed with prostate cancer at the beginning of the year. And he knew or knows a DJ called Brian Dobson, and here is Brian, who's a DJ for BlackCat Radio. They're based out of St. Neots, and so they are a community-based radio station that covers Huntingdonshire, really. So Dave got talking to Brian, and they do quite a lot of shows that are based on human topics that are of interest or education to the local community. And Brian was very enthusiastic to do something around prostate cancer, particularly this time of year with November, etc. So they decided to approach Dave's urologist surgeon to see if she would participate. And you're going to see she's an amazing woman, Miss Jyoti Shah. She was an Asian Woman of Achievement in 2015. And for her services to cancer and promoting prostate cancer diagnosis, she received her MBE from King Charles III in January of this year. So Dave then came to me, knowing that I had prostate cancer, and said, would I be willing to join? And I said, of course I will. I'll do anything to keep my mantra going of men in their 50s get a PSA test. It's eminently treatable if you get it early. And so that's what happened. And so what you're going to see is the video version of the radio show, because we were on Zoom, although obviously radio is radio. And you're going to hear Dave's story first, with some commentary then afterwards from Miss Shah. Then you'll hear my story, which is a little more tricky, and then some more commentary from Miss Shah. And then she's going to talk about some of the stuff that she's done to help promote men not being embarrassed and get out there and get a PSA test. So I hope, on behalf of all of us, I hope you really enjoy it. It's the first time I've done it, and the feedback apparently from the community yesterday was really good. So I hope there's some either education for you, or if you're thinking you might have worries about prostate cancer, then there's something to take away. And if you have got prostate cancer, then I hope you can take some positivity and encouragement out of today's show. So without further ado, here is BlackCat Radio Prostate Cancer Day. Cheers, everyone.
This is Your Voice with Brian Dobson on BlackCat Radio.
It was 25 years ago that some Australians came up with the idea to raise money for the RSPCA. It was called Growing Whiskers for Whiskers. I didn't know that. 5 years later, another group in Melbourne decided to grow moustaches in the 30 days of November to raise awareness of prostate cancer and depression in men. And since then, Movember has become an annual point in the calendar, focusing on the awareness, of course, of men's health issues, testicular cancer, mental health and prostate cancer. I'm joined this morning by local businessman Dave Young, who contacted me back in June and told me he had been diagnosed with prostate cancer. Also joining me is Alistair Knott. He too is a prostate cancer sufferer, but with a very different story to tell. And Dr. Jyoti Shah, MBE. She is a consultant urological surgeon with the North West Anglia NHS Foundation Trust, and she received her honour from King Charles in January of this year for her services to medicine and for her work in the screening and diagnosis of cancer patients during her career with the NHS, spanning almost 30 years.
Good morning to you all.
Good morning, Brian.
Dave, if I can come to you first, as I mentioned in the preamble, You contacted me in June of this year to ask if raising awareness of prostate cancer was something we'd be interested in helping with. And I recall by this time you had been diagnosed. Can you take us back to the very beginning of your journey that kicked all this off?
Sure. Thanks, Brian. So to go back to my beginning of my story, my journey, if you like, I have to take us back to January of this year. It was a Sunday afternoon. And the reason I remember this is because my partner had invited her mum and dad over for dinner for Sunday lunch. And during the afternoon, we were talking about various things. And then her dad, Dave, started to talk about prostate cancer and his journey, that he was diagnosed with prostate cancer about 12 years ago. And then he just randomly asked me, he said, Dave, have you had a PSA test? And I sort of looked at him and said, what's that? I don't really know what that is. And he described it as a simple blood test that will give an indication as to if something's not quite right within the prostate. And I said, no, I haven't had that as far as I'm aware, Dave. And he said, well, I think you should. I said, okay, I'll think about it. And I didn't really think about it that much, to be honest. But later on that night, I remember getting curious and went on to Dr. Google, the thing that perhaps we shouldn't do, but we all do. And I started typing in the symptoms of prostate cancer. And I started reading things like, do you need to pee more often during the night? And I remember thinking, no. Difficulty in starting to pee? No, that's not me. A weak flow? No. Or feeling that your bladder hasn't fully emptied. And it went through various things, Brian, about at least 10 different so-called symptoms. And I remember thinking, well, I haven't got any of these. I must be okay. About 3 days later, I bumped into my partner's dad again. And he said, have you arranged this GP appointment? I said, I haven't, Dave. I said, but I've done some research and I've looked at the symptoms around prostate cancer and I haven't got any of them, Dave. I don't think there's any point. And he was quite insistent that I should get this PSA test done. I think it was mainly because of my age. I was over 50. In fact, I was 60. So I said to Dave, tell you what, I'm seeing the GP in about a week's time about something else. So I'll mention it to them. So I did. So I said to the GP, I said, I've been talking about prostate cancer and PSA tests. I said, do you think that I need one or can I have one? And she started to ask me some various questions and they was all around symptoms, the same ones. Are you getting up at night, et cetera, et cetera? And I said no to all of them. And then she asked me some family history questions, like history of prostate cancer or cancer. I said no. So he said, okay, so because of your age mainly, again, 60, I'm going to put you forward for a PSA test. So on the way out, I spoke to the receptionist and booked in a blood test about 3 days later. Went for the blood test, had to wait for the results of the blood test. About 2 days later, I think it was, the GP rang me and said, Dave, we've had your results of your PSA and they're a little bit high. So what we want to do is we want to do another one in a month's time. I believe it was to get some sort of benchmark between the two. My first PSA was 5.93. So I had the second blood test about a month later. And again, the doctor rang me a couple of days after and said, your PSA now has risen to 6.24. We want to do some more investigation. So they sent me for an internal where they would actually feel the prostate. And I remember the nurse saying to me that it feels a little bit firm. I think she may have even used the word hard. So we want to send you for a scan. And I think from memory, she was saying that way we can find out some other things, but also we can establish the size of the prostate. So I went for that. A couple of days later, I got a phone call quite late in the day asking if I could come into the next day for a a scan. Sorry, yeah, I've lost my thread.
Can I just ask at this point, Dave, what were the things going through your mind, given that you'd just gone voluntarily for this test, and then obviously it sounds like there's something not right, and that's the last thing that you'd expect.
Yeah, sure. I was starting to get. I'd gone from not being hardly concerned at all to slightly concerned, for sure. So they sent me for the. They said they want to send you for me for a biopsy. So for those of you who don't know, a biopsy is where they'll take samples of the prostate, and that will be looked at in the lab. And my understanding is that that's how they can tell for sure whether cancer exists in the prostate. So I went for that. About a week later, I was called into, I think it was Addenbrooke's Hospital, to discuss the results of that biopsy. This is where it starts to get tough, so please forgive me. So I went with my partner, and we sat down, and the nurse said, "We've had the results of your biopsy, and unfortunately, we have found cancer within your prostate." So I remember hearing those words, cancer, and I remember feeling like I wasn't even in the room anymore. Excuse me. And there was like a conversation happening within the room, but it was somewhere else. So I'm in tears. My partner's in tears. What am I going to tell my children? Am I going to see my grandchildren? Am I going to die? They're the questions that were running through my head. So eventually I managed to pull myself together and said to the nurse, "Okay, what does this all mean?" She explained to me that this cancer likes to spread, and if it does spread, it likes to spread to the bones and to the lymph nodes. She explained to me if it hasn't spread, that the course of action would probably be hormone injections and radiotherapy. And I said, if it has spread, she then said, then we would be in management mode. We would have to manage the cancer. So she explained then that they want to send me for a couple of more tests to see whether the cancer had spread to the lymph nodes or to the bones. That happened about a week later. I then had to wait for the results of those to come through. I remember the day, Brian, very well, that I got the results as to whether it had spread or not. It was a Tuesday. It was a Tuesday afternoon. And the reason I remember this is because on a Tuesday, I have my granddaughter, Harper, who's 3 years old. And on a Tuesday, we always go to the park, to the swings. And there's this pretend car there that she loves to go on. So we got onto the car, and she would always say where she wanted to go. So that would be the beach or the zoo. And on this occasion, it was the zoo. So off we go, and we're on this pretend journey. And my phone rings, and I look at my phone, and it's the hospital. I knew that this call had the potential of changing everything. I answered the call. Hello. And the lady said, it's so-and-so from so-and-so hospital, and we've got the results of your scans. And I'm pleased to tell you that it has not spread. I remember just not being able to talk to her. And the tears were rolling down my face, and she was really good. She was amazing. And when eventually I managed to pull myself together and thanked her for the call. I then looked at Harper, my granddaughter, and I'm in bits. And she said, "Are you okay, Granddad?" I said, "Yeah, I'm fine." She said, "But why are you crying?" I said, "They're happy tears, Harper. I'm okay. It's going to be okay." I said, "Give me a hug." or a squeeze, as she would call it. And this hug went on, seemed to go on forever. Neither of us really, I don't think, wanted to let go. So I managed to sort myself out, and we carried on this imaginary journey to the beach. So where we are now is I'm halfway through my radiotherapy. Today was my 10th one. I've got 20 sessions to do. And I guess the hope is that, I'll beat this thing and everything will be okay. And that's kind of it, Brian, really.
What kind of timescale are we talking between you having to wait for your results? Because I guess in any situation when you're sitting not knowing what the outcome might be, the stress of that, the worry of it, how long did that period last for?
I remember thinking there was about 10 days to 2 weeks between having various things done and getting the results of them. It was quite quick.
And did you feel you kind of putting things on hold just because you were in this unknown space? You didn't know what the outcome was going to be. What was going through your mind at that point?
I remember when I got told that I had the cancer, it was how do I tell my children? What do I say? It was the uncertainties of it all. I guess everything was pivoting on results. I think to answer your question, Brian, I think it was about 10 days to 2 weeks before I got the results of the biopsy and the other scans for the bones and lymph nodes.
Dr. Shah, obviously listeners will be asking themselves the question, well, what is this PSA test? What's it about? How do I go about getting a test? And I think more importantly, does the result mean that I'm too late, or that I've got plenty of time, or does it not tell me anything? What can you unravel some of the myths behind what this test is all about? Because I've read about it and I've got confused with how it is conducted, what the results might say and not mean to anybody that doesn't understand the technical aspects of it. And also, I found when I went for a PSA test, I almost had to persuade my GP. I was asked so many questions. Well, why would you want a PSA test? To which I had to say, well, I'm of the age bracket that should have a test, and I've never had one. And one of my neighbours got a test, and he tested positive. So I just think it's a good thing to do. Well, why would you want it? And I said, well, just for peace of mind. So I felt it was quite a stressful process just to actually get the test. Is that your experience?
Yes. Good morning, Brian, and good morning to your listeners, and also Mr. Young. Thank you so much for your honesty. It can't have been easy to come on and talk so candidly about such a difficult subject. I never underestimate the impact of telling someone they've got cancer, equally telling them they haven't and allaying their anxieties. But there's this awful waiting period, whether it's a day, an hour, or weeks. And of course, the minute you use the word cancer, your questions, that's exactly what goes through people's minds. How long am I going to live? It's like a bomb's gone off in your head. So thank you so much for being so honest. So there are lots of tests, and they start with the simplest for prostate cancer. And the simplest one is, of course, the PSA blood test. It's a blood test, just that. The problem with the PSA, it stands for prostate-specific antigen. It's made by the prostate cells, both normal cells, as well as those that have cancer in them. And therein lies the problem with this PSA blood test. It's not an exact science. So it's a blood test. So every male will have a certain amount of PSA floating around in their blood. And some things will make it go up, one of which is cancer. And that's the problem. There are other things that make it go up as well. So the test needs to be interpreted in context. And because it's not an exact science. So to give you an example, as one gets older and one's prostate grows, which is a natural phenomenon, people always say, well, why is it growing? I say, well, why is your hair white? You know, this is all part of our aging process. So as your prostate grows, there'll be more normal cells because it's grown. And therefore, there's got to intuitively be a little bit more PSA because more cells are present, more cells are making it. So one of the things, for example, is as one gets older, one's prostate gets bigger, there'll be a little bit more PSA swishing about. So more if you're, say, 70 or 80 than if you're 50. So that needs to be interpreted. Another example is if you've gone and done a 40-kilometer bike ride, the impact of the your perineum rubbing on the saddle for all that time, that rubbing will release more PSA into the blood. And that doesn't mean you've got cancer. It just means you've been for a long bike ride. And so there are lots, and one of the biggest problems we see is people who've had a urine infection. So if you've had a urine infection, again, lots of cells are active, inflamed, red, angry because of the bug. And so again, more PSA. I've just seen a gentleman whose PSA, because of the urine infection, was 96. And when we've repeated it, it's come back down to normal. Normal for him being 3 point something. So, you know, the crux of that was don't do it at the time of an infection. So the whole test needs to be done with a bit of dialogue with the GP, because that's where this journey starts, and a bit of context. So every man over the age of 50 is entitled to a PSA blood test. And if you have other risk factors for prostate cancer, such as family history, and that's usually your father, your father's brother, so your paternal uncle, so it's a paternal lineage largely, or your paternal grandfather, then that increases your risk. And so over the age of 45, you could go and ask for a PSA blood test because your risk is higher. It's doubled. Or if you're Afro-Caribbean, because we know that if you're Afro-Caribbean, unfortunately, your risk of getting prostate cancer throughout your life is 1 in 4, compared to Caucasian white men, where the lifetime risk is 1 in 8. So we would say to black men over the age of 45, go and ask for a PSA blood test. But there needs to be that dialogue with the GP because we need to know there aren't other things going on that's going to artificially raise this blood test. So whilst, yes,
not an exact science, then you're saying
exactly
for that, and then presumably, if a test shows up a high level, and I don't know what is a high level. Obviously, you're talking single low figures at 1 minute, and then somebody who's got 90 plus. So obviously somewhere in the middle. The next step would be what? A biopsy?
So yes, there is no upper limit to a PSA. There's certainly a lower limit as to what would be normal. So for a man in his 80s, for example, one would accept a PSA of up to about 10. But as you get up, the younger men, there'll be a lower threshold for when you might want to start investigating it. But just suffice it to say, there's no upper limit. It can go in the tens of thousands. There's no upper limit. So if the PSA blood test, which is a protein into the blood from the prostate, whatever the cause of that leak into the blood, the next step would be your GP would, if they're suspecting prostate cancer, send you to someone like me in the hospital. And you'd be referred in as a suspected cancer, which means this is very protocol pathway driven. So we then as a hospital have, a finite amount of time in which we really want to get things sorted. Again, the target driven NHS we're currently in, but obviously that works in the patient's favour because you want it to be as quick as possible if you're at the other end. So you'll then come and see someone like me. I'd ask a few more questions, stick a finger in the back passage to feel the prostate. And that gives me two things. One is an estimate of size. So if your prostate's the size of a satsuma compared to a walnut, again, you're going to be allowed more PSA normally. So it's putting that blood test back into a context again, but then also feeling the surface to see what it feels like. Is it irregular? Are there lumps and bumps? Is it hard? So when you go to someone like us in hospital, we do it all the time, so you get a feel for normal versus not normal.
And when you
So
mentioned Dr. Shah about walnut versus satsuma, I was always led to believe or under the impression that a prostate was about the size of a walnut. So are you saying that it would be uncommon to have an enlarged or a much larger prostate, but that doesn't
no,
necessarily mean anything?
no, size does not in any way correlate with cancer. So you can have a small prostate. Normal would be the size of a walnut, absolutely. And equally, the prostate grows, as we said, as you get older. And so it can, it can be the size of a satsu, it can be anything in between. So normally walnuts about sort of 35 cc gland. That would be normal. It can grow. There's no upper limit. We've seen prostates that are 350 gram, so there's no, again, upper limit to that. But size, a big prostate can have cancer, a small prostate can have cancer. There's no correlation with size. So what you want with the size comment, it's about putting the PSA into a context, particularly if it's just borderline high, if it's 3 or 4, but actually is it 3 or 4 because of cancer, or is it 3 or 4 because the prostate's big? So it's putting that into a context, and then it's feeling it. Is it irregular? Is it lumpy? Is it bumpy?
Yeah.
What is it feeling like? Because a normal prostate should be smooth. So then, if there's that suspicion, what we do is an MRI scan of the prostate. And the MRI will give us an indication as to whether or not there's an abnormal area. And if there is, we then want to do a biopsy, which is where we take some bits of the prostate out. Now the default is under local anaesthetic, and they get looked at under a microscope. And then we're in the realms of 3 key questions. 1, have you got cancer? And it's those tests that are going to determine that. Number 2, what type of cancer? That's what looking at it under the microscope is going to tell us. And that goes back to the different types, the different grades, as we call them. Good cancers, bad cancers, the pussycats or the tigers. And then the third question, has it spread? And that would then go to, as Mr. Young has already said, the point about, well, yes, we know you've got cancer. This is the type that we've determined from the biopsy by looking at it under a microscope. But the next question is, has it spread? So we might need to do a CT scan, a CAT scan. We might need to do a bone scan because we know it commonly spreads to the bones. So are any of the bones in the skeleton anywhere, head to toe? Every bone gets visualized, and we look to see if it's spread anywhere. So those would be the two tests to answer the question, has it spread? We may need to do others, but those are the basics.
Very thorough then. You've said about age, but we've talked about predominantly over 50 and older people than that. Does it also affect younger people?
So prostate cancer is most commonly detected in this country in men in their 70s, sort of. About a third of the cases we pick up are over the age of 75. And we know that by the time men are in their 80s, it's a disease of the aging. And probably 8 out of 10 men over the age of 80 have it. And probably most men in their 90s, because of course we're seeing so many men now surviving so much longer. However, as we get to the younger cohort, we say over the age of 50. However, the youngest I know of was 42. And in fact, a Hollywood actor, Ben Stiller, was in his early 40s when he was diagnosed with prostate cancer. So we are seeing younger men. And of course, in the Afro-Caribbean population, not only do they get it from the age of 45, they tend to be more aggressive. They tend to be the nastier ones. So we want to pick them up as early as possible, and preferably before they've spread.
And as a precautionary thing, is it something that you can work ahead of and change your diet or do anything specific to try and avoid getting prostate cancer, or is it just one of these things that happens?
There are some risk factors. The first one is your age, and we've just talked about that. Well, you can't do anything about that, I'm
No.
afraid. So the second one is your genetics. You can't do anything about your relatives, your father, your grandfather. So can't influence that. And the third one that we know for sure is your ethnicity. And again, one can't influence that. So the three absolutely proven risk factors for prostate cancer, no one can do anything about. There are some other ones that that are associations rather than absolute. So we know smoking, for example, obesity, those if you're obese, if you're a smoker, that you're more likely than not to get it. But these are just associations. There are Western diet, red meats is thought to be associated with a higher risk, lesser incidence in the Far East, and that is thought to be because of the soya products might be protective. But these are all, evolving data, and it depends what you read as to whether you know it's good for you or bad for you. As I will say to everyone who comes in my clinic, everything in moderation.
Okay, thank you, Dr. Shah. We'll come back in a few minutes and we'll pick up the conversation on prostate cancer with Alistair Knott. Alistair's got a very different story to tell. Alistair, how did it all start for you?
Good morning, Brian. Good morning to all your listeners. Thanks for having me on. My story actually started in January 2022 when I was diagnosed with a tumour on my left kidney. So after much investigation, etc., the position of the tumour was such that it was almost as difficult to do a biopsy as it was to remove half of the kidney. So a decision, they had also investigated and they were 80-90% sure it was malignant. So in September 22, I had half my left kidney removed. I healed fine, and that was fine. And actually, it turned out that the tumour was benign. And I, funny enough, remember being quite annoyed at the time that despite this, that actually I'd lost half a kidney when I didn't have cancer. But the reason for saying that is because listening to Dave kind of brought back to me that first cancer moment, because my prostate cancer wasn't my first. And I can remember the agony at times you go through, especially when you're by yourself, trying to understand and unravel what's going on. So when I healed up well and we got into 2023, I then started to have some associated nerve problems, which we think was from the operation because it is around the hip area. Anyway, long story short, at the end of it, they were doing some investigations on around my bladder, and they decided to do a physical for PSA, which appeared to be, of my prostate, which appeared to be okay. But they then did a PSA test, and that was raised, left it for a month, and it was raised again. So a very similar story to Dave. So one thing I would say is, and it's sometimes a bit scary, you heard Ms. Shah talking about the cancer pathway, or highway as people call it. It is absolutely brilliant. I have some friends who suddenly get a letter saying that they're on the cancer pathway, and it really scares people. But I have to say, I mean, this is all NHS. It's absolutely fantastic. The speed that, and you probably got that from Dave's story, the speed that things happen is remarkable. So might have troubles in the NHS, but not when it comes to cancer diagnosis. So I went through the same process and went through it again, and I was diagnosed with prostate cancer in December 23. At that stage, it was classified to be what they call T2. So T1 is where there's just some cancer cells detected. T2 is where it's established in an organ. T3 is when it's erupted from the organ. And then T4 is not so good because that means it spread somewhere else. So it's classed as T2. Recommendation was, 60 years old, quite fit, have it removed. I also had the option and had the meeting to go down the radiotherapy and brachytherapy and radiotherapy and hormone therapy treatment. And she was very confident that would do as good a job, but at the position I appeared to be at, she couldn't give me a compelling reason why not to have removed. There was an instinct within my family that seemed removed, just get rid of it, Dad. Whether it was the right decision or not, I'm not sure, but there was a logic about just getting it out. So I had the prostate removed in February. All went well. I had a PSA test about 6 weeks later, and the PSA level was much, much lower. So I went on for my meeting with the urologist and the surgeon at that time, thinking this is all great, only to be told that they use very specific words, you'll find out, doctors. So they said far from ideal. They didn't say, not ideal or not what we expected, far from ideal. And then started to talk about high risk, aggressive. And the summary of it was that I had assumed, because the PSA had dropped from, I think, about 8.5 I was, down to about 0.47, that this was just legacy PSA left in my system. Turns out the PSA, once you had the prostate removed, disappears quite quickly. So if you're still producing PSA, something's awry. So that's why they said this is not what we expected. The full histology then, once they had the prostate out, was that you heard Ms. Shah say earlier that I think point 2 was what type of prostate cancer. In the original biopsy, I had the predictable prostate cancer. The final histology found out I had the very aggressive version. So they sent me for what's called a PSMA scan, which, if I'm correct, is a sort of specialized bone scan that looks specifically for prostate cancer. And unfortunately, so I should have just said, when they did the operation, they realized also something was awry, because they expected to find the prostate still clean with the cancer inside, but the cancer was already erupted. It was also in some of the other vessels surrounding the prostate. So they removed the lymph nodes on one side. It was particularly bad on the left side. So I had the PSMA scan and unfortunately confirmed that it had spread. So suddenly I've gone from T2 to T4, and that was a shocker. And it has spread, unfortunately, into my spine, at the base of my neck, and in my sort of chest region, back in my chest region, and in my pelvis. So the scenario over 4 months has suddenly become very different for me.
How were you processing this in your mind, given that one minute you've got this reduced PSA and you think everything's going to be okay, and then suddenly everything turned upside down?
It's interesting, actually, because I think perhaps because I've been through the kidney process, perhaps I've become slightly conditioned to this whole thing of cancer. Perhaps I've gone through the shock process, and I'm quite a positive person, I might add. So I remember being angry, to be honest. I think particularly when I went on with the urologist, I'd gone on the call to say, hey, just want to thank you, I've healed up, it's all great, only to be hit with something that's completely different. So I think I was either used to it or able to process it. It was much harder for the family who'd come along the ride with me and very much get rid of it and you're going to be great, Dad. It was much harder for them. And I think as I've gone forward, the family has now sort of processed that, what's going on, and we manage. So I've done okay, actually, surprisingly. And I've met other people who have cancer. And I think sometimes I wonder if you actually have the cancer, it's almost easier for you than the people who are around you. But I've managed it okay. So I had the PSMA, and then we moved from urology to oncology. And by this time, they told me, by the way, that I had to start on testosterone inhibitor, which is commonly called hormone therapy. And so people understand, prostate cancer needs testosterone to grow, to thrive. And so they had not done that with me before, but whenever this came up, they immediately put me on testosterone inhibitor. It's just a very easy injection in your stomach, and it lasts for about 3 months. And the stories I'd heard, some people need to be on 6 months, maybe 18 months, some longer, just to manage keep the prostate cancer dormant, is what they're saying. So because of particularly because it was detected in my spine, and that's not good if it grows, obviously, because your spinal cord's inside there, I was on the testosterone inhibitor. Once again, I had a PSA test, and it was down to a point, it was even lower. So once again, rather sillily, I went to the oncologist meeting thinking that actually this was doing such a good job, it was almost gone. And my first question to the oncologist was to say, hey, am I going to get away with not having to have another 3-month testosterone injection? And she very calmly turned around and said, Alistair, I have to say, you're going to be on testosterone inhibitor for the rest of your life. And so a bit like the previous meeting with the urologist, my expectations of good were kind of shattered, at the beginning of the meeting. So I realized at that stage, not so good. So it was a very good, they are very good, these people, I have to say. You've heard Dr. Shah. They're very good in the way they're communicating something that's very difficult, but they do it in a empathetic but also objective and functional way. They don't muck around. Yeah, they're telling you it as well as possible. So she explained what was happening and what was happening in my spine, which we don't quite understood fully as she explained. And it became clear that she said, unfortunately, we can't cure you. Yeah, so I think somebody said it earlier. I think Dave actually, wasn't it? They actually told him the opposite. They were able to cure him, or it was going to have to be managed. So she said, we can't cure, unfortunately. So it's going to be a palliative approach. And I remember being quite shocked. And my wife at that time got very upset because she said it'd be a palliative approach. And of course, the only time I'd heard of palliative is like end of life care.
Of course, yeah.
Of course, I found out it's not. Palliative is just a general term when you can't cure somebody, is a way to then manage the condition that you're in. So anyway, it was explained that they couldn't cure me, and this was about trying to hold back the cancer. So she made it clear that although it was in the bones, it was likely to be out and about in the blood, etc. And therefore, she strongly recommended immediate chemotherapy. Which, if you could see me on camera, you'd understand that I am on chemotherapy because I've got virtually no hair. And I started that in August. And that was 6 sessions of a specific prostate cancer chemotherapy called docetaxel. And so I have every 3 weeks for 6 sessions until November. And then the hope is that it will clean out any existing prostate cancer in my blood, because the primary thing we don't want is any more sites establishing themselves elsewhere. So that's been going okay. I've managed the chemotherapy all right. But the last bit is that, and Jim made clear in the meeting, my prognosis is not great, partly because it's out and about, it's already established. I have an aggressive form of it. So my prognosis is that 50% of people with my condition will make 5 years. I have a more positive outlook, as my family does. That means that 50% of the people are over 5 years.
Yep, yeah.
But we've all had to grow, absorb and accept realistically, it's not going to be the life expectancy that I had anticipated. And so you start to think about all things around your life that you might have arranged in one way, that you then have to turn on their head and arrange others. But overall, I remain very positive. I'm hoping at Christmas that everything will be clear. I'll have another PSMA scan, and they'll confirm no more established sites, and the existing sites are unchanged. And then I get on with life, and let's hope I don't hear. I'll be regularly tested every 3 months, but let's hope I don't hear anything for 2 or 3 years.
Well, we hope so. And what kind of things are you doing, or maybe you don't? Maybe it's just the way your makeup is. What do you do psychologically to kind of cast it aside and be positive and look to the future? Because that's an important thing with any illness, isn't it? You've got to try and cut through what's happening today and just keep looking forward. Well, how do you go about that?
Well, I think I'm lucky, as I said, because I think all through my life, I've always had a very positive outlook on things. My father died when I was a teenager, and I think that affected me, but also strengthened me. He was an amazing man. So throughout my career, I've always been seen as very positive, and I've continued that when I've retired. So I like to do things. I love challenges. So in this particular scenario, in sort of 2016 to 2020, I did triathlons, and I'm no athlete, by the way, but I'd started doing triathlons, and I got myself up to the stage where I was going to do the Copenhagen Ironman in 2020, and then COVID hit. Then really, after you come out of COVID, I've been ill a lot of the time since then. So I've completely lost all my condition or whatever. But I decided that I wanted to become an Ironman. And I actually started my own YouTube channel, which I can't believe I was going to do, but I have a real drive to try and help in any way I can. And this is a great example. And thanks to Dave for asking if I'd like to come on. I want to do everything I can to encourage men, particularly in their 50s, to get a PSA test. And interestingly, you asked the question, Brian, about because it seems slightly hard to get. I would absolutely reiterate that some doctors, for some reason, you go in, you hear your mate's got it, and say I'd like one, and they say, well, why? Got any symptoms? You haven't. So I tell people, if you think that's going to happen, just say to the doctor, I think I might be peeing a little bit more at night. Yeah, and as Miss Shah said, it is your right to have one, but I don't know quite why there's this sometimes reluctance to do it. So get your PSA test. And also, my other reason is that there are lots of people who are in more challenging situations than I am, but perhaps don't have quite as positive spirit as I have, and therefore they can get to a situation where they might have ambitions, however big or small, to do, but they just don't have the heart to do it. Yeah, they're perhaps more consumed by the condition. So by me saying that in my situation, I don't know what's going to happen, over the next few years, the fact that I'm going to take a big challenge to try and get back and be an Ironman again, hopefully inspires other ones to do it.
Brilliant.
And I'll just focus on positive stuff, Brian.
That's excellent. Yeah. And you've got a podcast, I believe, Alistair?
I've got a YouTube channel called Prostate Cancer Ironman. Yeah. So if you want to go on and have a giggle at my attempt,
we'll put a link to that and let people watch your journey, I suppose, which I think is really important to share. And I think your plan is to put the video or version of this interview up there as well.
Correct.
And it's really positive to hear that you are positive and that your family are positive, and I think that's a hugely important part of any illness. And you giving back to others a little bit about your journey to help them through theirs. And Dave, you'll be interested to know that I received a message from your daughter, Kylie, and this is what she said. If you don't mind me reading, she asked me to. It says, Dad, we're so proud of you and the hurdles you have overcome so far. Your resilience and determination to get through this testing time really has been something else. For you to take the time to try and get men talking about this awful subject and try to save even one, if it's just one life, it's incredibly selfless. We love you loads, Dad. Keep going. You got this. Always and forever by your side, Kylie. A lovely message there. Dr. Shah, can I just ask you, from what you've heard, and I know that you've spent many, many years of your career focusing on this topic, what kind of activities have you been undertaking recently to spread the word and get people to think more about prostate cancer?
So, yes, thank you, Brian. Really important question. So thank you for asking that. Over my years working with predominantly men and their families, as I've become more and more specialised in prostate cancer, the one thing I've noticed is this sort of thing rarely happens. You'll see women, the analogy being women with breast cancer, they'll be talking about it at every opportunity. They went there, they had this done in intimate detail. And yet men rarely talk about it. And whether that's, they're busy, they're embarrassed, they're afraid, or they just, don't want to address the issue. There are lots of reasons I can cite, but there's no doubt that there's a reluctance amongst menfolk, you menfolk here, to one, talk about things, and two, confront them. So I think this in particular, both Mr. Knott and Mr. Young, it's heart-wrenching hearing your stories. And it really is, do not underestimate how brave it is of you to come out and talk about this, because so many men still don't. I mean, I'll share with you, my father-in-law, my late father-in-law, was diagnosed with prostate cancer. And I was pivotal in making his diagnosis and directing his treatment, as you can imagine. But we're a big family. He has 5 sons. I'm married to one of them. And for me, it was really difficult when he said, as a family, we're not going to talk about this. We're not going to tell anyone. And there I am standing out in public saying, come on, everyone, let's talk about prostate cancer. I may as well have it tattooed on my forehead. And here's my own family saying not to. And I had to unpick that and try and say, no, Dad, actually, we have to do this. We have to talk about it, because more so now that I know you've got it, because that's what it would almost be hypocritical of me now to go out and tell other men to discuss it. So I do understand the reluctance. We've been there, but actually, this is now the most common cancer in men in the UK. And, 150 men are diagnosed with prostate cancer every day. Let's think about that over a week, over a month, over a year. And these are survivors, because if we pick you up early, we can cure you. So the essence is exactly that, twofold. One is, let's talk about prostate cancer. Let's get the awareness out there. Because you'll be surprised how many men still don't know where the prostate is or what it is, actually. So it's so important to go out and talk about it and raise awareness. And the second thing is then to offer men the opportunity to have their PSA blood test checked, which, as we've discussed already, it's difficult. There is a slight reluctance amongst primary care, and no doubt there are reasons they have for not wanting to do it, but everyone's entitled to it over the age of 50. And if you're an Afro-Caribbean man or a man with a family history over the age of 45. So go and get it done. And so what I realized was that if you're too afraid or too busy to come to me in the hospital to have it done, I shall come out to you. And this whole concept started in 2016, where I buddied up with my local football club, and the chairman of that football club, which I'll say is Burton Albion Football Club, was very supportive, and we ran a clinic in his football club. And that was interesting, because we were wondering, will anyone actually bother to turn up? And we were absolutely inundated. And I think there's the peer pressure, it's a less intimidating environment. It's one where men are obviously very comfortable in. There's free parking, coffee, tea, biscuits. It's a much less intimidating atmosphere than coming to the hospital. And I think we saw that work, and I've since gone out and I say, any supermarket, if they give me a photo booth, I'm not fussy where I feel prostates or take PSAs, I'll do it anywhere. So we will just, as a team, go out and run these clinics wherever possible. So you may be aware that in Peterborough, we did the first bus clinic. So we got one of these old COVID vaccination buses. A lot of them are just lying around now, not being used quite so much. So I said, well, I just want a bus. I call it the prostate bus. And woe betide, someone said, oh, Miss Shah, we found you a bus. Do you really want it? Yeah. And so we took that out into Peterborough town centre, literally outside the cathedral, outside the town hall. It was pouring it down with rain. It was the first Saturday last year after the Boxing Day sale. So we thought, well, we'll have the biggest footfall through the town centre, through going to the shops. But actually there we were, even Friday lunchtime, we had a meeting in the hospital going, can we just all phone a friend and tell them to come? Because if nobody turns up, it's really embarrassing. And at least if we get 5 or 10, we'll be on a winner. Well, I tell you what, when the bus arrived at 9 o'clock on that Saturday morning, it was freezing cold. It was pouring with rain. And there were already 50 men waiting in a very orderly queue around the town centre.
Wow.
And over the course of that day, over 200 men turned up, and we've replicated that model a number of times over the years. So we will do clinics wherever we're invited to, one, raise awareness, and two, get men tested. And to date, we've done 47 such clinics.
Wow.
Well done, you.
Well done.
Fantastic.
I mean, it's a voluntary, so I go with my team. We're all doing it in our own time, voluntarily. We've been to Edgbaston in fact, we teamed up with the Bob Willis Fund, and we were in Edgbaston at the Blue for Bob Day this year. So we really will go golf clubs, football clubs, Freemasons lodges, wherever we're invited. And it's really important to get the word out. There's a ripple effect, Brian, because every man we touch will go and tell their neighbour or
Exactly.
their drinking buddy in the pub that night over a pint, whatever. Just get talking.
Yeah.
Well,
Amazing.
that's great advice, and of course, this is how we've gone full circle now. This is why we're here having this conversation, because Dave, you contacted me all these months ago, and we only met on a business footing some years back, and
Yeah.
and now here we are talking about the topic. Is going to go on the YouTube channel, so we'll get the message out there. Maybe we'll get the bus down to St Neots and
Yeah.
link up with the St Neots Football Club or some of the sporting
Yeah,
clubs, because
perfect.
we've got a huge sporting population of men in the town. Just talking about it's great. Right at the very beginning, I go back to saying it was 25 years ago this year that the Australians came up with the ideas to raise money for the RSPCA, and they called that Growing Whiskers for Whiskers, which then kind of morphed into what we now know as Movember Growing Moustaches, and that whole process of supporting and raising awareness for prostate cancer, testicular cancer, and men's mental health. So I'm incredibly grateful for all of you coming on the program, Dave, for introducing me to the topic and prompting me to think, well, maybe I need to go and get another test, because I do have it in my paternal side of the family, 3 generations back. Alistair, for your story, and I wish you both a great future, and we'll keep following your progress. Dr. Shah, for the work that you've continued to do and champion time after time, year after year, to really get this topic talked about and to raise awareness. It's brilliant. I can't thank you enough for all being on the program today.